Good afternoon and welcome to Awakened Wellness. We're so glad to have you join us, and as usual, we have two fabulous shows with my host, Marie, and you're going to be very excited. She is telling me that there is some fabulous feedback and actually some likes on previous shows that we've done.
Yes, there is.
Okay.
Yeah, people love the massage therapy and you show a lot.
Oh, good.
And they love the guiding the journey one too, on the elder care and that kind of thing. Yeah.
Surprising.
Yeah, I was shocked. But
I'm
massage
a
therapy,
little
way,
surprised.
Yeah, way over the top. So I was shocked with that one.
I wonder why. Maybe it just took the veil off of everything.
I guess more the information that they didn't know was out there. So
interesting.
We're going to continue down that path if that's what people are listening to. So today we're going to do preventative care in you.
I was just going to say today's show, preventative care in you. So I can't wait to hear about this.
Wellness spin on it versus just about preventative care.
Okay. Yeah. Well, because it's multifaceted and the world has gotten a little different, and we're having to manage what's available and what's the best thing with some knowledge.
We'll see. All right. So first, a little bit of feedback.
Okay.
So I had one client that had a lot of left hip pain, and she had tried everything, and she'd been to her massage therapist, her chiropractor, she'd done Thai massage, she'd done the whole list over and over and over again. She wasn't getting any relief to the point where she wasn't walking very well. And I kept trying to explain to her that she had had a lumpectomy in the right armpit area.
Okay.
And the scar was pulling her across and shortening the leg.
Oh.
She couldn't get anyone to understand. She didn't understand. So finally one day we had a little bit of a tiff, and I just said, lay down. And then I made her block it, and then she tried to stretch her leg and she couldn't move her leg by blocking her armpit. So she had this huge awakening. So every time I see her now, it's getting better and better all the time. She has all these things that she's doing to mitigate it, and it's starting to loosen up. And now those people are working on the scar because she doesn't live locally to me.
Okay.
So she has to try to figure a lot of it out herself. But she's done an amazing job. But it was really hard for her to understand that her armpit could be causing her left leg shortage.
Okay.
But the armpit is a very sensitive area, and there's lots of nerves and stuff that run through there. So the body will protect it at all costs. And you can really shorten.
Wow. I'm trying to wrap my head around it, and I know a little bit, but
I had the same thing happen to me because of the long thoracic nerve damage, and they went through my armpit to take out the first rib.
The first rib, right.
Yeah, so I had to
learn. There's the pectorals and all the parts of your arms and the ligaments and tendons, everything kind of runs through that small area, right?
There's marma points in them, they call them, which are life force energy points that run through your armpit. The armpit is that important.
I think I was watching a little documentary where they were talking about this muscle here, and that if you gently pinch it, that if it's painful, that's where we hold some emotion and bad thoughts and stuff. So
it could be.
How funny that you just said that.
I just know from my work all these years that it's a really important area, and we probably should not be going in there surgically. We should find another way in there.
Someplace else. Okay.
Yeah. All right, another one. This is just a client who finally realizes that her choices are causing her health issues, and she's really taken that to heart, and she's made major, major life changes. So much so her spouse is jumping on board, so it's kind of cool. Yeah.
That's huge.
Yeah, it's very, very cool.
That not only that she done it for herself, that her husband saw it, recognized it, and is doing it too.
Yeah, the next one is kind of a fun one. I have a client, and her son came with her one time. He's 11. And he came with her probably about 8 months ago, and he could feel and sense the energy in the room. And then he started working on his mom with me. And then he got on the table, and he's a little hockey player, so he could feel it going through him, and he could feel his spine straightened out, and he had some kinks in his neck and everything else. So yesterday was voting day, and he was off from school. So he forced himself into her appointment so he could come and work on his mom and learn more about the energy stuff. And he picked my brain. It just comes so natural to him, which is really cool, really cool. And all he kept saying is she done yet? It's my turn. Is she done yet? It's my turn.
Wow, to recognize how to help somebody else, but also recognize that he can take that, do it to himself, and learn even more.
Yeah.
Bravo.
Yeah, so I was very
Wow,
cool.
11? That's excellent.
Yeah.
Well, his mind isn't occupied with all sorts of stuff.
And mom's not telling him that it's not real, and mom's letting him just experiment with it. And yeah.
Great job, Mom. Wow.
Yeah.
That's really exciting.
It is exciting. It is. All right, so preventative care.
Okay.
Okay, so preventative care focuses on maintaining our health and preventing illness, right? And we all know about the mammogram, the colonoscopy, all those things.
Right.
So we're going to talk about it from more of an awakened wellness perspective, because I see people doing it but do nothing with the information they get.
So they do all those tests, get a result, but
They do very minimal because they don't completely understand.
Okay.
They don't really ask themselves, why am I truly doing it? Because I'm supposed to, right? Because I'm supposed to get that information and maybe make a little change or not, or take a pill. But it's so much bigger than that. So much bigger than that. And we're missing the opportunity that's given to us with these screenings.
Okay.
So we have to learn. So what do you do with the information when you get it? Are you happy with the care that you're getting once there is findings? Because that's a big one. I had that come up recently. Do you understand the bigger picture of the importance of all the information you're getting? And what happens if you choose to ignore the results?
Well,
Is it a big deal or not?
it
Because
could
most people
be. You don't
think
know
it
until
is.
you look into it.
Yeah.
Till you
yeah.
question it.
So
All
we're
right.
going to start delving into that.
That's not merely a piece of paper with some answers on it.
But you can't just go into that until you ask yourself, how do you see yourself aging? So ask yourself, how do I see myself aging? What are you willing to do to achieve that goal?
Okay.
Right? Is your goal realistic according to your genetics, your present body condition, your knowledge, and your lifestyle choices, and your commitment to your health? Because all of those play a role. You know, you watch the 50-somethings now just trashing their bodies because they want to be so much more athletic and pushing to the point where they're getting, I know someone else on another surgery because of it, and the joints, the arrhythmias, everything else, because they're not looking at their genetics, they're not looking at their previous injuries, they just want to be this, and they're reading an article and they're going toward it. So what are you willing to do? Okay, so preventative care should be a part of a mindful practice. It should be a mindful practice. It should be considered that. And what I mean by that, okay? So we're going to look at it from, let's take your regular health screenings. They're essential, and their choices play a pivotal role. So let's take your colonoscopy.
Okay.
So what does that do for you? What do you learn?
So you find out if you have any polyps or growths, and find out if potentially you might have some cancerous growths, and if there's any issues.
So what do you do with that information?
Well, when you get your results, I would think you would talk with the doctor and say, what does this mean? If this is cancerous, what do I do? What are your thoughts?
I know 9 times out of 10, you might have diverticulosis, which is little pockets because you need lack of fiber. And they're going to say, we found that, take some fiber.
Okay. Or
eat more fiber.
Okay. Well, what's fiber? What kind of fiber? I don't know what you're talking about. I mean, I know what it is, but there's 7 million kinds on the shelves.
Right. So it gets kind of weird where people just kind of put a back seat or they take a pill and they think they've covered it. So let's get rid of the tests and look at our behaviors and see what tests those affect. So let's look at the foods we eat.
Okay.
What preventative care things are involved in that? So your colonoscopy, your mammogram, your blood sugar tests, your heart disease tests, whether you're obese or not, all your skin health, all your dental health.
Yeah.
All those preventative care things are tied to the food we eat.
Correct. That's the common denominator, is the food we eat.
Do people actually think of that?
No.
They went for the preventative care. I'm good.
Yep. Well, if I go for the test and then if it looks okay, then I don't have to do anything. If I go for the test, I get a result, well, then I can kind of...
And if you only have a blood sugar issue, you kind of manage, you take your metformin or whatever they tell you, but you don't realize you still on that path are going to have a bad colonoscopy in the future.
Right.
You might have a bad mammogram in the future. You might have heart disease in the future.
Because they're all related.
They're all related.
It's all, when you play what was that saying that, the hip is connected to the elbow's connected. That actually means something. It's not just a little silly saying or a game.
Right.
They're all connected.
They're all connected.
And it all matters.
Right.
Oh, I like it.
Okay,
See?
let's try exercise.
Okay.
What's that connected to in your body?
So exercise is connected to obviously your muscles, your bones, and strength and flexibility.
Your heart,
It's
your lungs,
all your organs,
bone
your
density,
brain.
your joints, your weight, right? Your colonoscopy, your mammogram, right? They're all in there.
Yep.
They're all in there. Every single one
Because
of them.
all the tests are being done on your body, and it's not like they take your heart out and
But
go,
we've
"Oh, let's do a test."
segregated them so
Correct.
much that
Yep.
we can't see that if we were more mindful, our everyday choices can mitigate all of that.
It's actually the simpler choice.
It's the simpler choice. It's the simpler
When all is said
choice.
and done, read the
So
labels,
what
know
happens
what you're
is
eating.
you go for your blood sugar and you realize it's off, but you haven't really changed much other than taking your blood sugar meds. Then you get a bad colonoscopy. So then you're trying to figure that one out. When all along, it's all the same thing. It's all the same thing.
So we need to be paying attention to our foods and our diets, first and foremost.
Okay. How about stress management?
So stress management, you need exercise, you need good food, you need mental health and stimulation.
It's going to affect our heart.
Yeah.
It'll affect our weight. It'll affect our bone density. It'll affect our relationships. It's going to affect your colon. It's going to affect your breast health.
Yes.
It's going to affect your dental health. It's going to affect everything.
Yeah.
Again.
Do you see it's not a common thread, it's a giant rope intertwining itself through this conversation.
But we've segregated everything so much.
That one thing has not...
Just living in balance, being mindful, asking to see what you need to see today, and changing those little stress areas and managing your life. It all figures itself out together because they all interconnect.
Right.
You don't just focus on the colon. You don't just focus on the breast health. You don't just focus on your pap smears. You don't just focus on. They're all interconnected.
And so we should be looking at a complete health, preventative care, and body health. And we need to be in charge of that because the doctors that we're seeing, and this is not a slam, but they all have specialties. And so that also reinforces our separating of the parts of the bodies and the diseases and what happens.
What's hydration affect?
Everything.
Digestion,
Digestion,
nutrient
your heart,
absorption,
your brain,
skin
blood,
health,
skin.
bone density,
Yep.
fatigue, headaches, colon, everything. Again, joints,
Yeah.
fluid levels in your body, your kidneys, your bladder, your lungs,
Rinses everything
your
out.
dental, everything.
Yep.
You can't get away from it.
Oh boy, are you getting this, people? Common denominator.
How about drugs and alcohol?
Well, drugs and alcohol will affect everything that water affects, except that it's a chemical and not good for you, and it'll affect your heart, your brain, your blood, your kidneys, your liver, your colon, your stomach.
Only illegal drugs?
No, all drugs.
All drugs.
All drugs.
So the ones you're taking because they told you to do it because you have a preventative care issue, but it's not anything.
So what you have to remember that medicine is a drug. So they like to say, take your medicine, but illicit medicines are drugs. So we have to remember they're all drugs.
So what drove me to do this is a client asked me a bunch of questions because her husband was diagnosed with type 2 diabetes. The doctor gave him the first pill. Then his weight was still off and his blood sugar was off. They gave him the second pill. Then they went to the Ozempic. And he's struggling. He's had enough. He's had enough. He wants to get off of it. So he goes online, he does some research, and he finds a keto diet. And this guy's telling him you don't need your meds anymore if you do the keto diet, if you're a diabetic. Well, now his blood sugars are off the hook because he's not taking the meds, but he's doing the keto diet. Because the drugs over time are doing the blood sugar managing, because in the beginning with type 2 diabetes, you can mitigate it and you can change it.
Okay.
But over time, you've stopped your body from doing what it's supposed to do.
And the drugs are doing it, so they're not going to...
There comes a point of
back
no
in.
return if you keep using the preventative care medicine and the Band-Aids.
Right.
Versus balancing your life, looking in the mirror, and changing your lifestyle.
Because the body does forget. It's like muscle memory. If you don't exercise a
these
muscle,
things
it
burn
forgets.
out. Your pancreas burns out. All of it. all of it is interconnected in everything that we do. I'm not saying we shouldn't enjoy life.
Right.
But everything in moderation and everything in balance.
Yeah. Wow. That really hits home, doesn't it?
I've watched it over and over again, and I still watch it every day, and people just don't get it, and they just do what the doctor or the alternative practitioner says, but they never own it. We have to start owning it.
I don't think we're going to have a choice very much.
We're not going to have a choice with the way medicine is going. We are not.
Not to be put, no fear mongering, but if we look realistically at where we are and what's available, we actually need to own this, as you say.
Okay, what do mindful practices affect?
Mindful practices.
In preventative care, what would that affect?
Well,
again,
because I've already been here for the last 15 minutes, everything inside and out, even my hair.
Nice job. How about our environment?
Oh, that's like a pressure cooker. So everything that you're already doing, and we're in an environment that we're not in charge of per se, depending on what you're talking environment.
But if your body's doing what it's supposed to do naturally,
then it should be able to deal with normal environmental events and issues.
But if you're not walking on a daily basis, you're eating foods that are backing up your system, foods that are just not cleansing you naturally, like greens cleanse your body naturally. You're not hydrated, you're holding on to toxins, all those things. Again, you're going to get bad preventative care results because you're not paying attention to how you live. And there's no doctor on this planet
that can fix that.
That can walk into your life and say what you're doing.
Because they'd have to be with you 24/7, and that's not going to happen.
Everybody's with you 15 minutes.
Yep.
Maybe 25.
And tick the boxes.
Yeah.
Do this, do this. Here's your medicine. See ya. Let me know how it goes.
How about your mental health?
So mental health is based on absolutely every single one of those things you mentioned before, and the environment drives it. So add them all together, and you've got potentially one whopping problem.
Right. Right. So let's go through a little bit of the testing.
Okay.
Okay, so now again, we're going to go back to the colonoscopy.
Her and her colonoscopy.
Well, it's the one you can go male, female. It's the one that saves the most lives, I think, in general. Yeah, because I get a lot of the over 50s all of a sudden losing their colon because they never wanted to bother with the vegetables, and then, or the colonoscopies, and they have family histories, and it could never happen to me.
There you go.
It can happen to you. It can happen to you. So the next time you have a colonoscopy, what are you going to do? You're going to ask yourself a whole bunch of questions, right?
Correct.
Why am I coming? What are my genetics?
Yeah.
Are they involved in this at all?
Right. What am I eating that's making me have to come do this again?
Right. If you're on the 5-year plan now versus the 10-year plan, what happened before that? I hear all the time, oh, I just had a couple polyps, I'm all set. I just had a couple polyps, I'm all set. Well, were they precancerous or not? I don't know. I don't know. Doesn't matter if it's male or female. I hear it all the time. So when I ask questions, people get a little annoyed with me because I'm digging too deep.
Right. Well, it's also, sort of a taboo subject to some extent, because if you open up that door, then you might have to go down the big C.
Well, you can prevent it. Most of it's preventable unless you have Lynch syndrome or something. So, and that's a younger version of it. So it's just more about being mindful and being present. So what I would do is that, again, mindful practice every day, 3 minutes a day, sitting quiet, asking to see what you need to see and what you're not seeing about your health. And why are you doing these tests? And are you taking these tests seriously? And are you really finding out
what you need to know?
Right. Like if you do get diagnosed with type 2 diabetes, do you realize you can reverse that if you choose to? If not, you might never be able to. And then your health is only going to go downhill from there. Your kidneys, your eyesight, all of that. Same with heart disease.
Right.
Right. So they're all interconnected in our preventative care, and they're all interconnected in a mindful practice.
Yeah.
And it doesn't have to be where you sit and meditate and you become a yogi. Just sitting quiet daily and questioning your choices and why you're doing them and what is the long-term consequences of your choices. Because everybody says, oh, I'm only doing it this once. This time isn't going to matter.
But that once turns into twice, turns into 3 times.
And tomorrow never comes.
Correct.
Tomorrow never comes. Holidays are coming. What's going to happen? This is my favorite. Yeah, I was going to eat, somebody's eating the stuff they're allergic to. I was going to stop eating it, but the holidays are coming, so I'm going to be exposed to it anyway, so I'll stop eating it after the holidays. Well, what happens when that hammer has been hitting your colon and your stomach and your immune system for those next couple of months that you're going to wait till the first of the year to do it? Does that go away?
Does that go away? It's still there or gets worse?
That affects all the preventative care.
It could. So you think of the domino effect. So what could be affecting your stomach right now if you don't take care of it or attempt to be serious about it for the next couple of months over the holidays, you could kick, say, your pancreas into having an issue because you didn't take care of this part.
And you could be on the verge of becoming a diabetic, but these holidays just put you over the edge now because you chose again to put it on the back burner because you're setting your body up to fail all the time. Because you're making these other things more important than you
the holidays
and
are
your
more
vision
important
for
than
aging.
You. Right.
So put yourself a vision of aging and then ask to see what you need to see about how your choices are affecting that. And then you'll know when you go to grab something, something's going to say inside of you, maybe not today.
Yep.
And it's going to start to clean up for you and you'll do it all by yourself. You don't need to go on the internet and start these crazy diets and all these other things. We already know our own answers. We just don't want to know our answers.
And I mean, there's so much information out there now that simply reading a label just to make sure you don't have some extra sugars and extra stuff in there. Yeah, you want to eat as wholesomely as you can and do the best that you can, but it doesn't hurt to read a label or two and just be sure and aware that you're not putting extra in your body. But you don't have to go freaky over it, but just be aware of it. There's enough information out there that it's not that hard. Because I do it now.
It's pretty crazy. Pretty crazy. So yeah, preventative care all has to do with us. You know, dental care is huge. A lot of people avoid the dentist like the plague.
Yeah, dental health is very important because taking care of your teeth can add 5 to 7 years to your life. And it's integral because what happens in here bacteria-wise goes directly down your throat. It can affect your heart and all the other parts as well.
Yeah, right. And the dentist can diagnose a bunch of illnesses.
Great. When they look at under your tongue, when they take that little cotton thing and they grab your tongue and they go like this.
Nutritional deficiencies, diabetes, heart disease, osteoporosis, acid reflux. They can find all those things from a dental exam.
Yep. So it's more than just how white your teeth are.
It's huge. It's huge. And people need to realize that these things are really important. And that is why the insurance companies do cover it now. That is part of it. Right. Because it saves them money in the long run.
Well, it is.
And they were mandated that too, but.
Yeah. We won't go there.
But anyway, so yeah, preventative care, think of it from a different perspective. Don't think of it as I'm just going for that one test I have to go because it's my 2-year rotation or whatever it is. Just take it to the next level. Sit with it. Ask yourself why you're doing it. Find out your family history. Find out what you're susceptible to with your past history and other drugs that you've already taken or other. And are you taking like digestive enzymes every day? What's the long-term effect of that? Are you stunting your body from digesting the food it's supposed to?
Well, the stomach acids stop working because you're always taking this antacid.
But people have this belief that they're taking supplements that it's never going to affect their overall health. If you're taking supplements, you have a health issue that's weighing on you. What is it and what can you do to mitigate that? Because the supplement isn't going to correct it. It's doing what a drug would do most times. So again, you're going to get a long-term result out of that.
Okay.
What can you do to correct yourself? And a lot of things are correctable if you take the time to be present with them.
Eat well, exercise, be mindful. And ask questions when you can.
It's all about balance. I'm not saying you shouldn't sit on the couch and watch a movie, but you shouldn't do it every day, all day.
Correct. Get up and move. Yes, I love this. Well, this was a tough show because it's all about being totally honest with yourself and asking the questions.
Everything affects everything, just like the armpit can affect the leg.
Okay. Well, on that note, I think we might have to have some science, some hanging body things here at the next class and point to the fingertip is touched to the, all those other parts. Well, thank you. I'm not making light of it. It's scary when you have these tests, and you're exactly right. We don't always pay attention to what they say.
You should never be that surprised.
Right.
You should have some idea what's going on with you.
Because that's why you're going to have the test, or that's why the doctor asked you to have it.
You should know your body's not right. You shouldn't be totally shocked.
Right. And you shouldn't be relying on somebody else to tell you all the time. Go there for
I'm a huge fan of diagnostics. I would never tell anybody not to do diagnostics, but you should have some understanding when you go to them. If you're eating trash all the time, you know you're going to have something wrong with your colon. Mm-hmm. You should know that. You shouldn't just go, oh my God.
Yeah.
Yeah.
Yeah, I love it. All right. Well, thank you for joining us, Marie and I, Jocelyn. Hope to see you at the next show. And please, any feedback that you have, Marie would love to hear from you, comments, questions,
Just
and where they can reach you.
awakenedwellness.life.
awakenedwellness.life. So we'll see you at the next show, and thanks for joining us. Have a mindful day.